Hi there, this is Tyler Simmet. I'm talking with Chuck Radis, the author of Go by Boat. He is a physician in rural Maine on Peaks Island, and he wrote a book called Go by Boat, which was about how he got lured or attracted to rural Maine and the story of practicing general medicine and being a physician there. Welcome, Dr. Radis.
Thanks for having me, Tyler. I appreciate it.
Well, I was intrigued because doctors are generally cautious people, particularly internists. We gauge risk and we don't do risky things. But you tell the story of training in Maine and saying, I love these people on the islands, I love working on the shore, and you chose a difficult life. What made you choose to be interesting?
Wow. Yeah. So, I, like everyone, you're wired to your background, and actually, my background was more in risk taking. I grew up with not very much supervision. My father passed away when I was young, and so as I got older, I was out hiking, taking long bike trips, and luckily getting through some of those poor judgment years without paying for it long term. So I always had a very open mind to adventure, and I did look at however difficult it was going to be practicing on the island as a great adventure. And I wasn't naive about it. I knew it would not be financially a great way to practice, but I was really interested in the challenge of it. So.
And you also had a partner in that your wife or wife to be at the beginning of the story and wife at the end of the story bought into the adventure.
Yes, she did. Sandy Corpella Radis. She grew up on a farm, a dairy farm in New Hampshire, and um, we both liked, I guess, what you might call an alternative lifestyle. Neither one of us really missed the easy accessibility to culture, and she, she really she really bought in very early about the idea of moving out to Peaks Island.
And are you from Maine?
No, just like in the stories about the naive doctor, moving to Alaska or something. I grew up in New Jersey, and came up to Maine to go to Bates College, and stayed on pretty much ever since. So.
And you talk about the 19 moves you had for clerkships in medical school and after. Um, did you get to evaluate areas, and what was it that drew you to certain areas or away from other areas?
Right. Well, I went to the Kansas City College of Osteopathic Medicine, and in those third and fourth clinical years, at least half of that was left up to the student to kind of work out connections for rotations. We had a 3-month rural rotation that was required. I did mine in Coffeyville, Kansas, and it was a place where the rodeo was nearby, and a very small town in which I really admired the family practitioner who I worked with under his wing. If you went into the emergency room in those days in Coffeyville, Kansas, they called your doctor, and your doctor came in day or night. And so I was kind of the surrogate for that as a fourth year. So it meant a lot of traveling during those years with my wife and I. And luckily, most of that worked out, meaning she did have a job responsibility for some of that, so we were apart. But for a lot of those rotations, we were together.
And a lot of the draw to rural locations, people want land, they want space, they love the water. What was it that attracted you to rural Maine, to Peaks Island?
Right. I think it was the people. Initially, I saw them as patients in my little community hospital in Portland. Peaks Island and the Casco Bay Islands are really only 2 to 6 miles away from Portland by water, and we're served by a ferry service. So I would see these people at the hospital being admitted and take care of them. So that's what initially drew me. I also really liked, this may seem a little odd, but I liked the fact that the islands were not gentrified at that point. The islands were the poorest neighborhoods of Portland. So they're actually city islands. And when you look at the census, they were the poorest islands. So it was a little bit of a challenge getting the National Health Service Corps. I worked with them to help pay off my medical school debt by practicing in a health manpower shortage area, which Peaks was, but it had never been designated, meaning it had never had a doctor through the program, but it was something that could be designated. So it was a process of getting it designated and eventually moving out here.
One of the things I liked about your book is it really read like a love story where you fell in love with the people and you fell in love with the community, but you fell in love with the community with problems. And when you noticed the problems, you just smiled, embraced it further, and found a way of dealing with it. Do you feel that you fell in love with a people with problems, or was it deeper or different?
Um, I've always thought that if you get to know a community well enough, these problems are everywhere. And so in many ways, the kinds of problems with alcohol or drug abuse or depression, suicides, as well as, really incredible organizations on the islands, community organizations that kind of held the thread together. I get the sense that really any practitioner experiences those kinds of cultures if they live long enough within the community and aren't traveling to the community. So.
Oh, I agree. Alcohol is not unique to islands or any place in America, but it was a huge part of the problems that you uncovered, that you saw.
Yeah, and continue to. And I know there's been statistics about primary care. Just how much of your primary care day is spent with either psychiatric problems or substance abuse problems as kind of in the background of the reason why the person is there for diabetes or other health issues. And the longer you're in the area, the more you're aware, really, at a basic level, just how pervasive those problems are.
And I apologize for my limited view of Maine, but I look at Maine as a place everybody wants to be between May and September. And then it gets too stormy, too cold. Was it different worlds in different seasons, or was it just different people showing up at certain times in certain areas?
Yeah, we do have our tourist influx from Memorial Day to Labor Day, and have always had that on Peaks, and so do the other islands. And then afterwards, our 800 year-round or so population is here for the remaining 8 months. And island businesses have always had a hard time making it through. They make their money during the summer, and then the rest of the year they really struggle. And some people, as they get older on the islands, if they could afford it, they leave for the winter. So we're probably down to about 650, 700 people. And yeah, it quite, there's parties that people celebrate the tourists leaving and everything. But there's a nice, there's always been a pretty good balance. We're not overrun by tourists because we're not really a place where people come to party or do things. It's mostly families who come out. So it's it's a little different than a tourist place that has lots to do.
Was there ever a storm or a problem that almost pushed you off the islands and back to the mainland?
Oh my goodness, yes. So when we first moved out here in 1985, a rare hurricane came up the coast, and it eventually hit Peaks Island, and the advice was to evacuate the island in the day or two before the hurricane hit. And nobody left the island. It's just, in fact, more people came out for the hurricane than left. And ultimately, that caused a lot of damage on the island. And, ultimately, we have a couple of policemen and public health people, and, there were no deaths associated with it, but and we've actually had a couple of terrible, terrible collision of storms in the fall where, you have microbursts, and there's parts of another outlying island where it looks as though a tornado just tore through it, and probably did. You don't think of Maine as tornadoes, but there's a swath about 200 yards wide across the island where everything was taken out. And so we have really severe winters here, and sometimes the inner bay does freeze. So it gets pretty cold.
Part of the problem with working in a small town and rural community is they have long memories. And we were talking about the longitudinal care. Was there ever an issue or a case where you felt, you talk about the sexual abuse of one of the scouts, was there a case that almost pushed you off the island or made it untenable?
No, I don't think so. I think partly.
How do you deal with the bad cases where people tend to remember it one way and you can't change it? I'm just thinking of my own practice where, one time I told a patient, let's skip your vaccines today because you've got so many other things going on. And 10 years later, I'm hearing Dr. Simmet doesn't like vaccines. I have to go, no, this was just one case.
Right. I guess part of it is that you're so busy, you're so flat out that the things that either don't work out well or people are angry with you about get pushed into the background really quickly with the next day. I think part of my writing later on was really just trying to figure out, really how I viewed those years, because it came during a time where I underestimated just how busy I would be. This wasn't, I couldn't really make a living just on one island. So I was going between 4 islands, and eventually, I had a part-time practice in Portland, and I was admitting my own patients. Luckily I had great coverage, but I was trying to manage people in the hospital. So any disappointments or conflicts I had with patients, kind of were pushed into the background pretty quickly.
One of the stories you told very eloquently and very descriptively was having to replace a trach in your office with blood everywhere, with complications, which is scary enough in the hospital with backup.
Yeah, sometimes you go back decades, and at the time there was no other option. This man wasn't going to go into town again because he was so stubborn. But you go, what was I thinking? It's like
you're negotiating with patients who aren't going to do what you say unless you negotiate with them.
That's right. It was really quite a negotiation. Not with, I don't want to give the impression that every patient was a negotiation. In fact, there were some people who were very quick to go into Portland for further testing. And as soon as they got to a level where they needed hospitalization, boom, we had them over there. But there was a core of people who basically never left the island, ever. And when they got sick, it was kind of like, well, either you get me better, or I guess this is where I'll die. I mean, it's hard to imagine for some people, but and those people were often very sick. And they ultimately, I did have to negotiate. And when I would play the trump card, I would say, no, I'm not going to do that. They would say, fine, okay, I guess I'll just go home. It was amazing. I would lose in those, but I didn't have as much leverage sometimes as I thought I did.
And we're living in a time when there's a lot of distrust of the system. And I think in medicine, we are the system because we have institutions behind us. We have ways of thinking that are generally rigid, particularly internists. Did the people on the island view you as the system, or did you become part of them, or were you a bridge?
Yeah. I'm not sure how to answer that really. I think it probably depended on the person. Ultimately, I think it was more my practice. I wasn't employed by anyone. And there was suspicion by some people, what would happen if they were hospitalized. And there was even then, the further negotiation, which was, was on staff at a small osteopathic hospital. And, and quite rightly for certain kinds of things, going to the medical center in Portland made perfect sense, and we didn't do cardiac casts at my little hospital. And, so it was always a negotiation about where people were going to go when they needed to be hospitalized sometimes. And that's occasionally where the osteopathic kind of subtle prejudice in the background came up, particularly in the mid 80s.
But also as a DO or an osteopathic physician, that may have helped get you accepted by the community. Were there things that helped about being a DO and things that you could do that were in your training that really mattered?
Yeah, I look back at it in retrospect. My training at KCOM, yeah, when you're in the midst of it, you don't always appreciate it. But as I've gotten older, and I practiced for 22 years in rheumatology, eventually with 5 other MDs, I realized that kind of the expectation that you would see the whole person and that you would understand where a hands-on approach might be very complementary. I think that connection, I think in a way, even the kinds of people the DO medical schools were admitting helped. That these were people often who had an easier time forming a connection with people. So the whole system of osteopathic medicine, I think, made it easier for me to connect.
Also, the touch that we're taught that also follows through into manipulation helps establish connections. Did
Yes.
the osteopathic community help as well? Having the osteopathic
Yeah.
hospital and
Yeah. Very much so, particularly with the specialists then who I would need for coverage when I was admitting my people. And the Portland area is a very strong osteopathic community. And, ultimately, that resulted in the medical school starting, during the time I was in practice. And that's continued to thrive.
University of New England?
University of New England, and that's where I've taught as an adjunct faculty person for a long time. And so there was a lot of like a lot of rural states, the majority of physicians, or at least a large percentage of the physicians practicing in rural areas of Maine, were DOs. So we were not a tiny minority in Maine, and I think that helped, that many of the people I was seeing had seen osteopathic physicians before. So,
although the main system of your support again was your wife, and you were very honest in your book. You talked about having issues with being where you were and doing what you were doing and how much time you were spending, and actually going for couples counseling. Can you talk a little bit about that?
sure. Yeah. Thanks for circling back to her, because I was a lucky guy when I met my wife in 1976, my last year in college. And she eventually, as a social worker, and she also did some couples counseling. She really could see, how what looked to be good relationships could fray and fall apart. And when we got to a point where I was so busy that I wasn't having time to really nurture our relationship and had enough time to exercise, enough time when we had our 2 children to really be the kind of father I thought I should be and would want to be, she basically said, we really need to go to couples counseling. And luckily, my answer was yes, because over and over, you've heard, and in your experience, sometimes people don't want to go to counseling, and or they just go once. And I think that really helped, that I went, and ultimately, we both made adjustments, and I found, eventually the old saying, you can be really devoted to your medical practice, but at a certain point, every time you say one more yes, you're saying no to the rest of your life, and you're saying no to your family. And not every yes is something that you have to say yes to. So there are choices that people have. And I realized that, there were choices I was making that I didn't have to say yes to. So we kind of rebalanced things. And luckily, she was very understanding to get me to that point.
And in medicine, given the high driving type A people who are involved, we often see that we won't go for counseling ourselves because we're fine. But if there's a relationship that's a problem, it's an easy way to get in where, I mean, myself included, that's how I got into counseling, was I needed couples counseling. And
Yeah,
it turns out that it wasn't just the relationship, it was who we are and how hard we drive.
right. I'd like to give a little shout out to Phil Slocum. He's a DO, pulmonologist.
Well,
Yeah. And, you know, uh, I think like a lot of us, Dr. Slocum was extremely hard driving here in the Portland area, just did a fantastic job as a pulmonologist. But, eventually he told me that in order to be the best physician he could be, he had to be the best person he could be. And to be the best person he had to be, he had to actually have time to be a person, and have relationships. And he eventually found that, rebalancing things, was really the way to have longevity in medicine. If we don't, there's burnout, there's problems that we all hope we
very
avoid.
important point.
Yeah.
And Phil's actually gone on to try and do this for the system. He's now working with Blue Ocean Technologies and Blue Ocean Practice, I believe.
Ah,
Um, what do you see the future of your community being and the future of healthcare in your community? Do you see a larger institution coming in and working with you, or is it still too small a community?
no, we've already gotten to that point, and it was a welcome change. After I left our little health center, a succession of private practitioners took it over, and then different organizations tried to come in, and we've now had a nurse practitioner coming to Peaks Island 3 days a week through the Maine Medical Center. So in a way, the clinic is now owned and operated by a large institution. We maintain a board of directors of Islanders that sets policy and how to use the building. And so I've been on that board ever since the mid 80s. And so I've stayed connected with, our goal has always been to maintain on island healthcare. And that's been a problem and a challenge at times. But this latest iteration has been going on now for about 6 years. It's been really stable. We're really happy about where that's leading to Peaks. And, Peaks now is not what it was 20 or 30 years ago in good ways and not so good ways. I mean, we are a much wealthier island, and taxes have gone off, people have moved off. And so we still have kind of the same background of people here that were here in the 80s, but we also have a lot of newer wealth out here. It's changed things some.
Is there a favorite story, favorite patient you'd want to share from your experiences there?
Huh. Well, I often think about Johanna von Tilling, who was an elderly woman who lived on a neighboring island called Cliff Island, another 5-6 miles from here. And I would see her on the island from time to time. She was elderly by that time. And she's an example of people who come to the islands who are unusual, and it fits their personality. She was German. She left Germany at the end of World War II, and eventually became the teacher for about 12 children on Cliff Island. That's how many kids were in their school. And she was one of those patients who often would never want to come to Portland. And so I ended up seeing her at home for various problems that would have been best managed somewhere else. So ultimately, Johanna has been gone quite a while, but she was memorable.
I know the feeling. Well, the book is Go by Boat. It is coming out April 15th, I believe.
Yes.
And
Yes.
we'll have a link to where people can buy it. I appreciate you taking the time to talk to me and sharing your experiences, and I'm sure people will enjoy the book.
Well, thank you so much. I've really enjoyed it, speaking with you and seeing your musical painting in the background there. That's very nice. And thanks for the opportunity. I appreciate it.
Thank you.
Thank you. Bye-bye now.